everyone, welcome to week number 9. This week we only have one chapter to focus on, and the nice thing is that this is a chapter we discussed in your fundamentals course at Rasmussen. This week we are looking at chapter 43, which is assisting with medical emergencies and medical preparedness, or emergency preparedness. So let's start our overview. So like I said, this is a chapter that will focus on medical emergencies and your responsibility in those situations. As a medical assistant, you will need training in these areas to make sure that you are prepared. Anytime there is a type of emergency, you must notify the physician immediately. They need to know about the emergency so that way they can jump in and help as well. You may even need to, depending on the severity of a situation, contact some emergency services, such as emergency medical responders, the emergency medical technicians, or EMTs, advanced medical technicians, or the paramedics. When we start the conversation of medical emergencies, we need to discuss the Good Samaritan laws. Now, this isn't the first time you have heard me say this. I talked about it in fundamentals. We had a bloodborne pathogens that talked about it. So we've had a couple of conversations about the Good Samaritan law. But it's important to remember that Good Samaritan laws were established to encourage healthcare professionals to volunteer in emergency services without the fear of financial liability. This is generally going to apply to situations both inside and outside of your medical office or medical clinic. As a medical assistant, you have 3 primary legal responsibilities in any emergency. First is the duty to act within your scope of practice. Remember that you are accountable for yourself, your employer, and the public. If you see that help needs to be applied and it is outside your scope of practice, do not do it. Call for help immediately. The second responsibility is to ensure and document the constant emergency. So always making sure that you're documenting, because in the medical world, if you do not document, it did not happen. So you always want to make sure that you are writing what happened, you're documenting what happened, and you're doing it in a very effective and safe manner. The third responsibility is to do all that you can to prevent these emergencies. So for example, you want to have an emergency preparedness plan ready. What do we do in case of a fire? What do we do in case of a tornado? What do we do in case of a flood? You always want to make sure that you have those preparedness plans ready so you can jump into action. There are some guidelines for providing emergency care, and as a medical assistant, you must stay up to date on the emergency plans of your office or facility and those of the community. You will also need to be able to handle emergencies that come in 3 different types of situations. You can have those come in over the phone, near your office building, or in the office itself. When we talk about receiving the phone calls of emergencies, this is where you're going to put in those triaging skills. Because emergencies that come over the phone are going to be the most common that you will see. Now, triage means that you're going to assess and prioritize the emergencies by the care that is needed. So that's going to be an important topic this week for your discussion post. So please make sure that you're up to date on your triage knowledge. Now, every doctor's office will have an emergency crash cart available for situations. You will see some items that are contained and some supplies that are contained are those that may be needed during an emergency. And this crash cart will be constantly and always instantly accessible to anyone within the office. It cannot be held from anyone because you don't know who's going to come upon an emergency and need to use that. With the crash cart, or close to it, will be what we call an emergency medical box or drug box. Some of the drugs that you might see in there are medications such as activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, and normal saline. You don't ever know what you're going to need in a situation, so we pack that full of things that could potentially be very useful during an emergency. So now that we got all that out of the way, let's discuss some of the fun things, such as some of the medical emergencies you might encounter. Now, hopefully all of you remember the training that we did from last quarter on your CPR and what to do if you need to use it. Please remember that there is 1 and 2 person responders. Hopefully you remember how that changes for adults and children, and how to use CPR, rescue breathing, and that AED, or automated defibrillator. One of the other medical emergencies you might have is respiratory distress. This could be a reaction to a long-term disease, such as COPD, or chronic obstructive pulmonary disease. It could be due to an emergency situation, such as anaphylactic response to a medication. And as the medical assistant, you need to be able to recognize the signs and symptoms of respiratory distress. Those are things such as acute anxiety with gasping breaths, bradypnea, which is the slow breathing that is less than 8 breaths per minute. Patients could turn blue or have what we call as cyanosis. They'll have a failure of the chest to rise and fall. They could have nasal flaring or noisy breathing. And they could actually have tachypnea, which is actually a rapid breathing of more than 24 breaths per minute. You, as the medical assistant, may be asked to administer oxygen to the patient to help regulate their breathing back to a normal level. Another emergency that you might see is chest pain. So heart attacks are the leading cause of death for both men and women. As the medical assistant, you will need to know what the signs and symptoms of a heart attack are. You could see things such as pain, and that pain will be in the middle or left side of the chest. It's generally going to be described as a sharp, stabbing, crushing, or squeezing pain. The pain could radiate to the left arm or to the back and up the neck. Now, here's a situation if a patient calls you and complains of having chest pain and you think it could potentially be a heart attack. The most important thing that you want to do is, you want to keep the caller on the line. Don't ever hang up with them. Don't leave them alone. You stay on the phone with them and ask a coworker to dial 911 for the patient. You'll want to write down their name and their location so that way EMS services will know how to get to them. And you are going to stay on that phone until EMS arrives or the emergency medical services arrive. Shock is the last medical emergency I'm going to discuss for the video. Shock is the collapse of the cardiovascular system, and it is caused by an insufficient cardiac output. Some of the signs and symptoms that you will see are weakness, rapid heart rate, thirst. They will have cool or clammy skin. They will have some confusion, or they could be unresponsive, and they may even have nausea and vomiting. So now we're going to kind of switch roles and we're going to talk about some first aid or other emergencies that you may encounter. Remember that first aid is the assistance given to any person suffering a sudden illness or injury, with the care provided to prevent life, prevent the condition from worsening, and or promote recovery. Some situations you may offer first aid to are patients who are bleeding, have open wounds, soft tissue injuries, or burns. So I'm going to discuss each one of those a little bit further. So when we talk about bleeding, this could be both internal and external. External bleeding occurs when the skin is broken, and this type of bleeding can be controlled. It's really important to know that you can control external bleeding. You'll want to apply a pressure bandage around the injured part and maintain pressure on the site. If the blood seeps through that pressure bandage, you will want to change the bandage. Do not remove the first one as the clotting formation has already happened. Taking off the old one will actually rip those clots away, and you'll have to start over from scratch. So just apply the new ones on top. Now, if the bleeding is internal, that means that the bleeding is occurring with tissue damage and intact skin. Unfortunately, this type is unlikely to be diagnosed in a medical office. It will generally be more in a hospital setting. The open wounds, these are generally seldom life-threatening unless they penetrate places such as the head, chest, throat, or abdomen. If any of those items have been punctured or you see that there's an open wound from one of those, contact emergency medical services right away and stay with the patient until they arrive. As a medical assistant, one thing you can do is always try to control the bleeding of an open wound if that's what they have. Most of the time the injury is, again, not life-threatening, and it will just require you to irrigate, do some debridement or removing of the debris, applying sutures, and antibiotics. For open wounds, there are some wound care pointers to always follow. When applying a dressing, you'll want a sterile covering placed directly over the wound to absorb the blood and other fluids. Always make sure it is sterile, because if it is non-sterile, it could put more bacteria into the area. When applying a bandage, which has a strap or a binding material, you should hold the dressing in place. So for example, you could have rolling gauze or elastic bandages such as Band-Aids. You'll want to hold the pressure gauze in place, so you can use one of those two items to hold that in place. Soft tissue injuries is trauma that involves both the skin and the underlying tissues. For soft tissue injuries, what you will want to do is elevate the body part above the head, above the heart, and apply a cold pack. Now, if it's a more severe injury, you want to immobilize that body part that has been injured. And lastly, we have burns. This is a type of injury that can occur when an area of tissue is destroyed by the action of physical heat, by chemical activity, or high electrical currents, or heavy exposure to radiation. The severity of the burn will depend on the amount of damage and the depth of the damage that the tissue ensued. Now, when you are treating burns, cool water can be used to soothe the area if there are no broken blisters. Burns should be dressed with a dry, sterile bandage, and the pain should be managed with injectable medications only if ordered by the physician. Alright, so I'm going to leave the rest of the chapter up to you to read and review. So I strongly encourage you to do so, as this chapter will help you fulfill not only the needs of your discussion board this week, but also your quiz. It will also help you be prepared and ready to go for your lab classes this week. So for your discussion board this week, we are focusing on those triaging skills and knowing who comes first. So your discussion post will actually give you a scenario of what will happen, and you will need to decipher that scenario and make some good triage judgment calls. You will need to think about how you're going to prepare for the situation that is discussed in the scenario. You'll need to think about and put into place a plan. And you're going to need to think about any other resources or extra help that you could use, what supplies you will need, and make sure that you have those readily available. You will have 10 patients to treat, and you need to explain how you're going to treat those 10 patients based off of the situation in the scenario. Please make sure that your initial discussion post is completed Tuesday by midnight, and that you have 2 responses to classmates completed Saturday by midnight. All right, and lastly for this week, you do have 1 quiz again. It will be over chapter 43 and dealing with those medical emergencies. It will be back to the normal way of consisting of 10 multiple choice questions with a 10-minute time limit. All right, guys, I hope all of you have a wonderful week. Please don't hesitate to reach out to me if you need me for any questions, comments, concerns, or if you just need some help with our class or another class. I will help you in any way I possibly can. Have a wonderful week, guys. Bye-bye.